So the approach to myelofibrosis in the future is going to involve many new agents, and one of the most interesting ones of those is targeting the BCL lymphoma family pathway and intrinsic apoptosis pathway with Navitoclax. And historically, for me, this is really interesting because it kind of loops back 20 or maybe more years to when I was doing my PhD. And there was a beautiful paper published in the New England Journal of Medicine showing overexpression of BCL-XL and BCL2 family members in patients with PV. And so we know there's a link between JAK2, overactivity, and BCL expression. And so the pathways are actually linked. And so recently we've been addressing that by using Navitoclax in combination with Ruxolitinib. And we've been seeing data with the ADVAT strategy in the second-line setting, which has been published, and very nice biological analyses being done. And then more recently at EHA, we saw what happens if you use this combination upfront instead of going, for example, with Ruxolitinib. So I think this is really exciting, and it's biologically very plausible. Intrinsically, it could be quite challenging because one of the main side effects of Navitoclax is actually thrombocytopenia, which is an issue for MF patients. So we probably would need to select patients, and some patients, because of thrombocytopenia, would be excluded. But nonetheless, I think it's a really exciting potential prospect. There are 2 phase 3 randomized trials addressing this, Transform-1 upfront and Transform-2 second line. So good to think about putting your patients in these studies and watching out for that data.